listening to part 91 of our series, 7 Medicines, The Wise Woman Way, with Susan Wade at Time Monk Radio. Hello, Susan. Welcome back to Time Monk Radio.
Hi, Gemini. You know, often as we've been going through these things, we would talk about, have you tasted that or have you done that? But this kind of stuff with surgery is not the kind of thing that I can casually ask you, oh, did you do this last week? However, I was curious, and you certainly don't have to answer the question because it's a somewhat personal question, as to if you or friends of yours have had any surgical experiences that you wanted to mention along the lines of the kinds of things that I was talking about in our first couple of weeks this month about suddenly being surprised by a bill or having surgery that it turns out you didn't really need or things like that.
Yes, actually, I personally had a surgery, and it was something that I probably didn't have to do. But they said, oh, down the road, if you don't do it, you could experience these kind of complications. And it was jaw surgery, actually. And I didn't realize, nor did I do enough research prior to going into that surgery, of how risky it actually was. And I was horrified afterwards when I realized what a big risk I took. So that was kind of surprising to me and to my family. My father was very like, oh my goodness, I'm glad I didn't know the risks in front of it.
Especially if we're electing surgery because somebody says something might happen in the future.
Yes. And it's not something I would ever go through again. Ever.
And as we talked about in the past couple of weeks, if somebody says, this could happen, there are usually good alternatives to surgery to help prevent that from happening.
Yes, I imagine
so. I was told if we don't operate on your wrist and break it and reset it, you'll get arthritis. But I knew that doing that would up my chances of getting arthritis, and that in fact, what would help prevent it would be my proactive care of my wrist.
Right. And Susan, the other thing, too, is the amount of people that come out of the hospital with infections, and oftentimes near-fatal infections. And I had that happen to a family member where the anesthesiologist, they traced it back to, did not wash his hands between patients and gave my grandmother a terrible infection.
Yes. Yeah, one of the things that certainly we all deserve to have with us when we are immobilized and anesthesiized and traumatized is an advocate.
Yes.
An advocate who is obnoxious enough to make sure the anesthesiologist washes their hands.
Yes.
Right? It doesn't do to have an advocate who says, well, I noticed they didn't wash their hands, but I was afraid to say something. Now, if we're going to haul an advocate into the hospital with us, that advocate better be a real loudmouth.
I agree.
I mean, I don't know if I mentioned, but they did a study where they installed cameras over the sinks where doctors washed their hands and told the doctors and nurses that they were doing a study on how often they washed their hands. And still, 80% of them didn't wash their hands.
Isn't that something?
I mean, most of us think, oops, step one, wash your hands. So, and I certainly understand washing your hands a lot, leads to chapped skin and so on. But so we are deep into high-tech medicine, into surgery, and into really seeing if we need that surgery, and if we do, how can we protect ourselves before, during, and after that. One way is to avoid preoperative tests. 7 medical specialty societies advise against preoperative stress tests. And, unless specific to the surgery, X-rays and blood tests as well. I was amazed because most places that you check in that are going to do surgery are going to say, we're going to need to run all of these tests on you and why? To protect them in case something goes wrong. Again, we need to have an advocate or be our own advocate to say, what is the purpose of this test? What will the results of this test show? How is this test important to my surgery and my healing from the surgery? All right. We have asked a lot of questions of others. Now it's time to focus in on ourselves. You have decided you are going to have surgery, whether you're having surgery because you need a joint replacement, because you're having cancer taken out, because you wish to see better, because you wish to change the shape or the tautness of your body. There are many, many, many reasons for surgery, but it's all going to happen to you. So once you set that surgical date, start really focusing on you. Improve your diet, improve your fitness, and improve your mental state. These three things have been shown to be as important as the skill and knowledge of the surgeon and the anesthesiologist, and they are totally within your control. Now, we're not saying you have to make a complete turnaround. Even a little bit will help. Even for a few days, even a small change. In fact, I've come to believe that a little bit and a small change is better than big, big, big sweeping changes, because I've seen people who've said, all right, I've been an alcoholic for 35 years and now I'm stopping. I'm not gonna drink any alcohol at all. And it's a really good idea before surgery, stop drinking alcohol. But if you're an alcoholic and you stop drinking alcohol, your health does not immediately benefit. As a matter of fact, it puts you in a really kind of risky, difficult place. And I've seen people who made that great decision to stop drinking and were doing it because of surgery and then had very bad results from the surgery, whereas if they cut down, they probably would have had better results. Your body has become, if you've been an alcoholic for 35 years, I'm very accustomed to that. Big, sweeping changes are not what we're looking for here. You've been smoking cigarettes for 40 years. This is not the time to absolutely quit, but cut back. Think of this as not as I'm going to completely remake myself into a different person, but I'm going to make a couple of small changes that I've already been thinking about that would really make me better. Here's some of my favorite small, easy improvements. Of course, you know what number one is going to be, and you're right. Add 2 to 4 cups of nourishing herbal infusion to your daily diet. You can go to YouTube, and you can see me and Monica Jean, my wonderful granddaughter, making nourishing herbal infusions and talking about them. If you're gearing up for surgery, stinging nettle and comfrey leaf are excellent choices. Nettle is loaded with iron and all kinds of other minerals, makes your blood really rich, helps prevent hemorrhage during surgery, and comfrey is there for healing. It improves the strength and flexibility and the healing ability of all tissues in the body, but especially connective tissue, from the muscles to the joints, and the fascia, and the tissues of that surround the heart and the lungs that are inside the respiratory tract and the digestive tract. So stinging nettle infusion, comfrey infusion, 2 to 4 cups of nourishing herbal infusion added to your diet every day. Wow. Want to make a smaller change? Add a quart of each one per week for the weeks before surgery. Another small change that can reap really big benefits when it comes to surgery, and that is initiate or increase a daily meditation practice. You do not have to change into a robe, get out the incense, ring a bell or have an altar in order to meditate. All you need to do is close your eyes. It can indeed be done in the clothes you are wearing right now. And yes, even 5 minutes counts. What we're looking for is what's called the relaxation response. And you can go back to mind medicine. Oh gosh, it's more than a year ago now that we were talking about mind medicine. If you want to learn more about how daily meditation or deep relaxation benefits you every day of your life, but especially before, during, and after surgery. If we are having surgery, it is probably something that's concerning us. There are some elective surgeries, like LASIK surgery, to improve vision that we probably wouldn't be too worried about, but most people, if they're having surgery, are worried about something, and many people get worried about the surgery itself. So what do? Turn your worry into healing imagery and affirmation. I'm so worried that I might have a stroke. How can we turn that into an affirmation? I affirm that I am free from strokes. Really, give yourself what is called positive reinforcement. When you are thinking about the surgery, when you are thinking about what's happening, rather than letting your worries take the upper hand, let your affirmations take the upper hand. Stop taking supplements. Now, Andrew Weil, in his 10 steps to successful surgery, actually suggests that you do take supplements. Stop taking supplements. Okay, this is from Susun here. Susun says stop taking supplements. You will also find that most surgeons say stop taking supplements. Now, the odd person out here is Dr. Andrew Weil. And in his article, 10 Steps to Successful Surgery, he says take large amounts of supplements. What can I say? Don't. It has not been shown to be helpful to take large amounts of supplements. If you want to increase the amount of carotenes in your diet by eating more tomato sauce or drinking carrot juice or baking sweet potatoes or squash, that is a really good idea. If you want to up the ante on vitamin C in your diet by consuming more grapefruit juice or more orange juice or more baked potatoes or sauerkraut, that is a really good idea. But don't take supplements. He does mention that even his recommendation to take vitamin E is iffy because it can really increase bleeding, except in coronary bypass surgery, and vitamin E after the surgery can be quite helpful. It turns out that anesthesia robs the body of phosphate, and low phosphate levels lead to post-surgical infections. So before surgery, you can eat more phosphate-rich foods, and those would include cheese, yogurt, shrimp, fish, meat, lentils, and pumpkin seeds. You would also want to increase the amount of zinc-rich foods in your diet, and those would be spinach, nuts, chocolate, beans, meat, and seafood. Having a large amount of zinc available also helps decrease postoperative infections and improves postoperative healing. Do take the time to increase the amount of iron in your blood with molasses, stinging nettle infusion, or yellow dockroot tincture. You don't need all of them. Any one of them can be used. Having large amounts of iron in your blood will guard against blood loss, against postoperative fatigue and help ward off infections. Let's see what Andrew Weil has as his other 10 steps to successful surgery. And Dr. Andrew Weil, of course, is known for really moving integrative medicine into the mainstream. As I said, I didn't want to be alternative. I wanted to be complementary. So his article suggests that you start by taking a tonic. Prepare for surgery by strengthening your body by taking a tonic. And he, of course, suggests his article on tonics. But I would say, rather than a tonic, take an adaptogen. And that's partly because the whole thing of tonics is kind of iffy. And I find that in a great many places, things that are actually stimulants are passed off as tonics. So adaptogenic herbs like ginseng, eleutherococcus, many of the adaptogens act as excellent overall tonics to the entire body. And, of course, nourishing herbal infusions are tonics as well. And his number 2 step is to use an antioxidant supplement, and Susan says don't do that. However, interestingly enough, I would concur with him when he says ask for IV vitamin C. And I quote from his article, Dr. Andrew Weil says, I urge anyone undergoing surgery to ask your surgeon to authorize vitamin C in an IV drip, 20 grams in a 24-hour period from the time you go into surgery until the IV is removed. Your doctor will probably balk. 9 times out of 10, the surgeon is going to say, but be persistent. Be persistent because the result is worth it. And then he talks about the results. And I got to say, they certainly do seem worth it. And he ends by saying one patient who insisted on having a vitamin C IV healed so rapidly that his surgeon now orders it for all of his cases. Number 4, relax. A review of medical research published in the American Psychological Association Journal found that preoperative patients who learned relaxation techniques had less anxiety, left the hospital sooner, and had fewer post-surgical complications. Use guided imagery. Guided imagery has proved its worth, especially in surgical patients. A double-blind study of 130 patients who had colorectal surgery. Those who listened to guided imagery tapes for 3 days prior and 6 days after surgery rated their anxiety levels as significantly lower than a control group and described their pain to be half as severe as that in the control group, used 37% less pain medication, and were released from the hospital 2 days sooner. The Academy for Guided Imagery is a resource that Andrew Weil suggests, and he says that he uses guided imagery and that its reach is for everything. I quote, there is no physical ailment that is beyond its reach. This might seem like the same thing, but it's actually different. Receive healing energy. So use guided imagery, that's you doing it. Receive healing energy means someone else is actually sending it to you. And that can be just people at home sending you love, people at your church praying for you, or it can be therapeutic touch, Reiki, hands-on healing, those kinds of things. Therapeutic touch is practiced primarily by registered nurses, and in some hospitals, it's a regular thing. You can simply ask for therapeutic. I would like therapeutic touch when I'm in recovery from my surgery. For a list of hospitals and practitioners you can contact Nurse Healers Professional Association Therapeutic Touch. And Reiki, of course, which is gaining more and more popularity. And there is a Reiki Alliance, which will help you get in touch with Reiki practitioners in your area. Number 7, listen to healing music. Remember that Dr. Weil himself has a CD of music for healing, that he is a great believer in the healing power of music and has done some research and has put out a CD of music that he thinks is especially healing. My dear friend Kay Gardner, who died of a heart attack some years ago, also did a lot of work in healing music. And, of course, Stephen Halpern has done decades of work in healing music. And so you should be able to find some healing music that really works for you. According to the Association of Operating Room Nurses Journal, ambulatory surgery patients who listen to their choice of music while waiting for surgery had significantly lower heart rates. So bring your music with you. If you want to make your own healing tape to listen to during surgery, see if you can play some background music that is especially tranquil. And again, I'm kind of imagining hearing this, and everybody in that operating theater is going to be influenced by this. So it's not just you who's hearing I heal rapidly and well, it's their minds too, and they're then going to be giving you that healing energy you're going to be receiving from them. So bring that tape of healing statements, that CD of healing statements, that MP3, whatever it is. I'm going to be honest with you, says Andrew Weil. Your request for this is going to stand a really good chance of being turned down. So be ready to say, I'll take care of it myself. I'll have my advocate come in to the operating theater, and that, interestingly enough, is often allowed, and they'll play the music for me. So if the anesthesiologist and the surgeon don't want to be bothered, get somebody else to do it for you. Get advance permission to bring your music into the operating room. Don't wait until the day of surgery. 9, have a support network. Andrew Weil says, I truly know that human connectedness is vital to optimum health. So don't forego that connectedness because you're having surgery. Arrange to have someone with you in the hospital before, during, and after the surgery. You need an advocate, especially in the intensive care unit when you come out of surgery. And going to have visitors, going to be in the hospital long enough for visitors, ask them to bring you your favorite foods. Be sure that there's somebody there with you or somebody that you can easily get in touch with. And interestingly enough, who you share your room with is going to have a very big influence on your outcome. They found that people who shared a room with a patient who'd already undergone the surgery they were about to have had less anxiety, were more active after the operation, and went home sooner than people who roomed alone. And number 10, work with your surgical team. It used to be the common thing that the anesthesiologist would come to you the night before, and the two of you would get to know each other. But nowadays, managed care has compressed schedules to such a degree that this is rare still. See if you can arrange to meet with your anesthesiologist before surgery, even if you call the anesthesiologist's cell phone. The Journal of the American Medical Association reported a study of 208 15 patients awaiting surgery, and a 5 to 10 minute talk with the anesthesiologist was more physically and mentally calming than a sedative. You don't necessarily want to be taking a sedative before surgery. Remember, some of the bad things that happen with surgery is when you're too deep, when you go too under and you stop breathing, and that sedative is going to make that more likely. I had a wonderful experience. I did have another surgery after my tonsils was out, and that was a hernia repair. And I did gather my resources for that hernia repair, and especially my social network, and I told them when it was and what was going to be happening. And I felt so wonderful as I experienced the love of those people coming into me. When I woke up, because they asked me to be overnight in the hospital before my hernia, when I woke up from sleeping overnight in the hospital, I felt surrounded by that loving care. When they came and said, everybody gets a sedative, I said, I don't need a sedative. I'm feeling great. As a matter of fact, to tell you how great I was feeling, they had a lot of us there for hernia repairs. I was at the Schuldeis Clinic, which does only hernia repairs, and they had a young man, a young football player who looked to be like, 18 or 19, and he was just beside himself with terror about the upcoming surgery. And they had given him a sedative, and then they had given him a stronger sedative, and they couldn't give him anything stronger because they were worried about what would happen during surgery. And looking around, they finally decided that what they were going to do is put him next to me. And they did indeed bring him over and set him next to me. And within 10 minutes, he had calmed down. And this wasn't that I was coaching him or telling him anything or leading him through any guided imagery. It's simply that I was receiving so much love and so much care from all the people that love me and care about me. So engage that specific energy, and you will find yourself moving into your surgery with grace and being able to move out of it, getting what it is you really wanted from the surgery. You might also want to donate your blood just in case, Things don't always go exactly the way we think they ought to go. And if they're not going the way we think they ought to go, and especially if suddenly you're bleeding, what better thing than to have your own blood on hand, ready to go, and you're not going to be getting any diseases from anybody, and you're going to be getting exactly the right blood type? That is a good idea. Humanize your experience. When you come out of surgery, arrange to have your own pillow, your own nightgown, food you like, music you prefer, photos of loved ones. Just because it's an institution doesn't mean you have to be institutionalized. You're allowed to bring those things with you. And be clear about what tests you want done on any materials that are excised from your body. This is something you need to decide on beforehand. You'll also want to consider prehab and to create a recovery plan. And we'll talk about that next week.
Thank you, Susan. And this concludes part 91 of our series, The 7 Medicines, The Wise Woman Way with Susan Weed at Time Monk Radio.